Hello and welcome to the Older Adult Podcast brought to you by the Institute of Clinical Excellence. I'm Dr. Trissa Hutchinson, occupational therapist, and I am beyond excited to share with you information today about a therapist's role in the medication management for older adults. So I'm going to talk you through how to elevate your practice to be the clinician that goes a little step above your peers and look at your patient's medications, screen and help them with feeling well and healthy and avoiding frustrating outcomes based on maybe an error with medications. So let's dive in. We're going to talk about 3 main action steps: screening, educating, and then advocating and collaborating. So we're first going to dive into screening. When it comes to your older adults, I need you to be aware of what, when, and why when it comes to all of their medications. What medication, when do they take it, why do they take it? I don't want you to only look at their prescription medications. I want you to also make sure that you're screening any medication that they may be taking over the counter, that they are self-prescribing, that they might have heard something on like Dr. Google that could help them. So again, what, when, why of your medications, not just prescription, but also the ones that are over the counter that your older adults are taking. Also, make sure that you're not forgetting to ask about if there are any PRN or as needed medications that your patient may be taking, because those and when they're being taken could also play a huge role in your therapy outcomes. In order to have a better understanding when you're knowing the what, when, and why, and to take that a step further, I'm next going to ask you to familiarize yourself with what's called the Beers criteria or the Beers list. That is BEERS. Yes, it sounds like the beverage, but it's not the beverage. This is a list that's put out by the American Geriatrics Society on a very routine basis, and it's kept well up to date. And what it does is it has lists of different medication classes as well as specifics as far as which medication an older adult over the age of 65 may have a negative outcome or may be inappropriate for an older adult, again, over the age of 65 to be taking. This list is very, very detailed, very comprehensive. For example, it has lists of like antipsychotics that oftentimes your individuals with dementia may be taking. It has antihistamines, talking about like maybe your patient's taking Benadryl because, it's springtime and allergies are out. And so they're taking Benadryl, but this actually could play a pretty important role and have a negative outcome for your patient. One that oftentimes my patients currently take are oxybutynin, which is for overactive bladder, or if someone feels like they're urinating way too frequently, they may be prescribed oxybutynin. And that is actually on the Beers list. It increases risk of falls. It also increases the risk of cognitive impairment or symptoms of dementia. There is an alternative medication called Myrbetriq that treats similar symptoms instead of and does not have those same side effects. So there's oftentimes lots of medications that our patients are currently taking on this list, and there are alternatives. We just have to advocate and educate about them. We'll get to that next. When it comes to this list, I do want you to know that if you just Google the list right out there, you can pull up a PDF of the whole list. It's easy to search under. If you want to be a little more tech savvy with it or have it a little more readily available, there is an app that you can get for your phone. It costs $10 per year. We have no affiliation with them or anything. I'm just sharing as a resource, but $10 a year, and it has all of the criteria. You can just plug in a medication and it will pop up if the patient medication is on the Beers list or not. And then it also includes like what are the potential risks. Obviously, there may be medications that are on the list that could be a potential risk for your patient, and your provider already knows, but they are willing to take that risk. That's okay. That is up to the provider and the patient to understand. But as long as you are bringing that to the forefront, because let's face it, sometimes things do get missed. Maybe your patient has moved and their medication list wasn't updated by a former provider, and now the current provider wasn't aware of the changes and it wasn't taken off their list, etc. Things happen, and so it's our job to make sure that we are familiarizing ourselves. So again, when it comes to the Beers criteria, very helpful to understand and just have a quick screen go-to for your patients. One thing I like to always point out about this is oftentimes I have patients who have been prescribed a certain medication, or they've been taking it for 20 plus years for some condition, and they were prescribed it when they were like 50. Well, now they're 70, meaning they fall in that older adult range according to the AGS Beers criteria. And so now we might need to look at an alternate option for the patient. So just be mindful that just because someone's taking it forever may, not be the best option. Maybe now that their metabolism is slowing down in terms of being able to process medication, now we need to look at some sort of other option for them. Okay, so you're aware of what, when, and why, and the Beers criteria. Then I also need you to be able to screen your patient's understanding of their medication. I want you to ask your patient what medication they're taking. Like, ask them. Don't just always go to the caregiver. Ask if they can tell you and identify how many they're supposed to take, when they're supposed to take it. Are they supposed to take it on an empty stomach with food, etc.? And try not to guide them. Start by just asking them to explain to you what their medication routine looks like. That will tell you a lot often, very, very quickly. If you start to notice anything that is off a little bit, that's when, if you don't feel comfortable, you can refer to maybe a further evaluation with OT, maybe with nursing. Maybe you refer back to provider about we need to look at some of these things because this patient isn't understanding what their dose is. I also need you to be able to watch for symptoms with your patient. So when you're screening, you are looking for, are they lethargic? Are they feeling off? Are they feeling dizzy? What are physical symptoms that we may see in our patients or from our patients during session that could be a direct result or correlation to a medication? Yes, oftentimes we're referred patients for some sort of a physical problem or assumption of a physical problem. However, medications play a huge role in that. I will give you a few examples. I had an individual recently. She came to me and she had been seen in the past for vertigo. And she came back and she said, my vertigo must be back. I just feel super dizzy. I don't know what's going on. And with just a quick screen asking if anything has changed, have you had any changes in your medication? It had been 2 days since she got prescribed a different blood pressure medication because she was having issues with her blood pressure being too elevated. We contacted her provider. Her provider said we would like her to stay on that medication for 5 to 7 days to see if it will just level out just slightly. And if there's improvement in that time, then we want her to maintain or you continue with that medication. We just need to give it a few days. So that being said, provider wants the patient to stay on the medication. Then I took the role of educating the patient on how important it is to stay well hydrated. She was feeling dizzy, so we talked about ways to maintain her safety by keeping her walker close by. All of those good things, making sure her brakes are locked. We talked about some alternate routes around her home and community just for the 5 to 7 days to get her through. With that being said, after those 5 to 7 days, she actually did level out. She felt way better. Her dizziness symptoms were completely gone and her blood pressure was managed. So I'm glad we had that communication with the provider. And in the meantime, we helped her stay on her feet, stay as well as possible by giving her some of those tips and tricks to keep her safe in the meantime. As she felt better, I made sure I had a conversation about like, now we can back off. Don't feel like you have to be super cautious. You don't have to take these alternate routes, et cetera, because now you're leveled out and things are better. So making sure we're not creating those nocebos. Okay. Started off with screening. Lots of ideas for the screening and the beers list, knowing when our patients are taking what medication, et cetera. Then I dove in a little bit already about education, but that's what we're going to dive into now. So you know how to screen your patient for their medication. Now we're going to talk about educating your patient. When it comes to education, I need you to emphasize to your patients why their medications are important. What are they taking them for? Oftentimes, I've had patients tell me, "Oh, I don't take that medication." And when I ask them what it's for, they can't tell me. When I explain, "Oh, you're taking this medication for X, Y, and Z reason," suddenly they decide that that might be pretty important. I also try to educate that if we have to decide as the patient, if the patient does not want to take a specific medication, they decided, I understand why, I understand the risk, I don't want to take this medication. I advocate and educate the patient that it is important and vital that we tell their provider that they are no longer taking that medication. It's important because if our patient has any sort of other health complication or medical complication, and the provider assumes that they're taking a medication correctly, we obviously can have some major complications here. Because if they're already prescribed a certain dose or they're prescribed a different medication, et cetera, it can be a really big deal if our providers aren't aware of what our patients are actually doing on a day-to-day basis. So that can be extremely important. Education as far as medication management and making sure our caregivers are understanding when, where, what, et cetera, patients should be taking their medications can be extremely important as well. Right now, I am doing a lot of education with some of my patient caseload as far as when PRN medication are to be used appropriately. I have lots of patients with advanced stage dementia that have some dementia-related behaviors, and an antipsychotic is being administered for sleeplessness. But when I did routine evaluation for the patient throughout the day, she was actually just sleeping in till like noon. And so she wasn't ready to go to bed by 10:30. And so rather than providing her a medication to make her sleep at 10:30, we talked about, can we instead try a non-pharmaceutical approach and wake her up at 9:30 or 10 a.m. so that she's more tired by the time it's time to go to bed. So education on just like routine and how medications can affect your patient throughout the day. Education about, side effects and teaching others how to screen for medication safety as well can be important. I have one patient right now. She was doing great all throughout our plan of care. One of our final sessions, she was like falling asleep the entire session. And I asked, did she not sleep well last night? Like, what's going on? And it turned out that she had also been given a PRN medication for having dementia-related behaviors. But had I not said something to the nurse that was in charge, the nurse wasn't aware that the patient currently was getting very, very lethargic and fatigued from these medications or from her PRN medication, and that the dose was probably just too high or it was taken too close to her prescribed dose. So we talked about that. Nurse can come in and do an audit, spread out the medications, talk to the provider about maybe adjusting the dose, et cetera. And it can make a huge difference in your patient's life. So also educating your patients. One last thing on education is making sure that we are providing resources for our patients so we can educate them on things in the community, such as like healthy packs, which are little plastic little packages, et cetera. I assume I guess that's how to explain that, but it's little packages in a giant roll that your medications are divided up by the day and time of day, and you get them on like one huge roll, comes right from the pharmacy. So your patient just has to pull the last pack for the time that they need to take their meds, and then they can stay on track that way. There's also like medication setup. Oftentimes people can have, they'll like Medicare A if they're on home health. Sometimes that can be an option, or there can be like private pay with some home health nurses as well for medication setup and follow-up. Okay, so we know how to screen. Then we're going to really, really push at education. And then last, we're going to talk about advocating and collaborating. So when it comes to advocating and collaborating, this is extremely essential in your role. You are there to advocate for your patient to live their best life. You are often going to be the one that will be the loudest voice when it comes to your patient's care. You often get to spend a ton of time with them when it comes to medical, like a medical provider spending time with them. Oftentimes you are going to be the one that is with them the most often, or the most for the most duration of time at one single sitting. Listening to them and advocating for what they are feeling or what they are doing, what they are hearing, what they are saying, etc., to their providers is extremely important. Collaborating as a result is very important as well. Making sure that we're reaching out to providers and communicating patients' issues or our own concerns, as well as potentially requesting or referring to a PharmD or a pharmacist for a medication review to make sure that our patients' medications are on track. For example, I one time was working with an individual. She was taking 24 medications. She was taking 6 blood pressure medications. And after review, that was cut way, way down. She was one of those individuals that is the example of going, she had moved and had multiple providers. And so things just didn't get all cleaned up on her chart. And so then when healthcare professionals took over her medications, then they were just getting the full list and had to follow and abide by what the list had said. So rather, we requested that a PharmD did a whole medication review, and then she was able to get multiple of those medications discharged. So, okay, team. When it comes to medication management, we play a very critical role for our patients' health and our patients' safety. We often get to see our patients more than anybody else, and it's our responsibility to screen, educate, advocate, and collaborate with other providers to make sure that our patients can take their medications well and take them appropriately, and only take the ones that are necessary. So, team, have a great night. And I hope that you all hop onto the ICE Physio app, check out our amazing content, lots of free resources for you all, lots of fun courses coming up in the older adult division, level 1, level 2 online courses, lots of live courses coming on. I hope to see you guys in the future. Thank you.